Wealth management is not just for the wealthy. Everyone is entitled to their best retirement possible. Welcome to The Retirement Engineer with Jim Kruzan, your path to a bigger, bolder retirement. Brought to you by Kaydan Wealth Management, a firm that specializes in serving the mobility technology industry. In this podcast, we help you maximize your resources and engineer your best retirement through a process-driven approach so you can get the little things right. Drawing from years of expertise, Jim and his guests will simplify complex wealth management strategies and explore actionable ideas to help you protect your hard-earned wealth and take control of your future. Now, on to the show.
Welcome back to The Retirement Engineer. I'm Patrice Sikora, alongside your host, Jim Kruzan. Now, today's episode explores a vital topic for anyone nearing or navigating retirement: funding health care before and after you leave the workforce. From bridging the gap between retirement and Medicare eligibility to the intricacies of long-term care, we're here to guide you through these complex decisions. And joining us is Darren Brennan, a certified financial planner and chartered retirement planning counselor from Kaydan Wealth Management. He brings invaluable insights into crafting strategies that help safeguard your health and retirement funds. Jim, over to you.
Well, thanks, Pat, and welcome, Darren. We're excited to have him on the call. He'll help us kind of walk through some of these nuances. If you think about it, retirement planning is really about cash flow management. A successful retirement plan certainly has as an element a successful cash flow strategy. And there's nothing more complicated or potentially lumpy from a cash flow perspective than healthcare, especially if somebody's retiring sometime before Medicare. There's a whole series of decisions that have to be made. And as with anything retirement planning based, the sooner you consider these contingencies, the sooner you put in place a plan that may allow for these contingencies, the better off you are. It's a really, really big issue. In fact, in retirement, healthcare cost is either the first, the largest, or the second largest expense one will have. If it is second, it's only second to shelter. And to give you an idea of what that means today, a couple age 65, between then to the end of their plan, they are expected to spend about $315,000 on healthcare. That would be insurance premiums, Medicare premiums, deductibles, co-pays, non-reimbursable medical expenses, and all of that. And that's a really, really big number, especially when you consider on average, the average American family only has about $333,000 accumulated for retirement. Now, again, that's the average, and there are a lot of people who have more than that, and certainly some that have less. But if that's what we're looking at, you can certainly understand the pressures and the concerns about planning properly for post-retirement healthcare costs. And that's what we're going to talk about. One of the biggest issues, and we kind of call it this coverage gap, it's that period of time between the time someone retires and the time that they are eligible for Medicare. Used to be, most people would retire in and around Medicare, 65. Today, there's a tremendous number of people who tend to retire much earlier than that. A lot of the unions 20, 30 years ago kind of put about this 30 and out mentality. And as a result, there are a tremendous number of people who retire somewhat less than 65. So how do we fill this gap? What do we do? Do we have other coverages? What resources do we use as well? It becomes really kind of an interesting math problem when we look at how to fill this gap. The other problem with this is there aren't an awful lot of retirees who have coverage available to them through their employer. Used to be, employers would cover most retirees beyond retirement. That's really, truly no longer the case. In fact, today, if you look at large corporations, forget about small companies or mom and pop firms, but large corporations, they offer on average 21% of those large corporations offer some form of post-retirement health care. It might be coverage until 65. It might be some supplement until 65, or it might be some cash supplement or cash distribution after one turns 65. So the solution here isn't broad-based. It's not one size fits all. It literally changes and is different with everyone. And that number, 21%, is down from 29% just 4 years ago, 2020. So the trend is really much, much less. And again, this is large corporations. And when you consider the fact that the biggest employer in the country are small firms, typically with less than 200 employees, the expectation is there's even fewer still that are covered. And that percentage, 21%, is also highly skewed. If you are a public employee, meaning you work in some way, shape, or form for government, well, then 63% of those people have some type of post-retirement health care. But if you work for a private or profit company, publicly traded firm, small mom and pop shop, et cetera, it's more like 10%. And again, we're talking with respect to large employers in both cases. So you can see that there are an awful lot of people that fall into this gap. And that's really what we want to talk about. And we want to kind of frame how to go about financing this and what strategies you might want to consider having in place so you're not surprised by what those costs kind of look like.
Yeah, Jim, many of the clients, that I meet with, their number one concern is how do we bridge that gap? Certainly if you want to retire before 65, which is when you can enroll in Medicare, generally their spouses aren't the exact same age. So there's also, we need to plan for that. And then even some of the trend called the FIRE movement, which is financial independence, retire early. If someone wants to retire at 50 or 55, now you have a decade or more you need to plan for health insurance. And it is a big risk to just forgive and not have health insurance through retirement. Even if when you're planning, you need to start planning when you're in your 20s and 30s. You don't really understand how expensive, as you threw those numbers out, it's going to cost over $300,000 or so to fund healthcare and retirement. So just at a high level, we'll go through some of your options. If you're eligible for COBRA insurance, meaning you retire or you're separated from employer pre-65, you can enroll in and keep your same health insurance, which is referred to as COBRA, which was written into law in the 1980s. The benefits of that is you keep your same plan that you're currently under in your employer. So if you retire midway through the year and you've already hit your out-of-pocket maximum or your deductibles, those continue once you enroll in COBRA and then reset the next year. The downside to COBRA would be most don't understand that if the employer is actually picking up most of your premiums while you're working. So if you're looking at $50 or $100 a pay for health insurance, many would be surprised once you enroll in COBRA, they do not have to subsidize your health insurance anymore, and you can go from $50, $100 a pay to $1,000 or more a month. There is a law, I believe it's 102%, because they usually charge a service charge, but again, extremely expensive if you don't prepare for it. Could wipe out your retirement savings when you're budgeting that to have fun, traveling or your hobbies. Now we got to account for extra money. But again, 18 months is generally how long you can keep COBRA. Can go up to 36 months. There's different qualifying events, widowed, things like that. Other options would be to go through the exchange if you forgive COBRA, which we'll touch on a little bit later. One other thing I'd like to mention about COBRA as well, not everyone is eligible for it. So you mentioned small businesses. If you're under 20 employees, they do not have to offer you COBRA insurance. So you could essentially retire or be separated and be out of health insurance right away. So you need to plan for that. The one thing I'd say too, just circle back with the gap, is it's very, as you mentioned, unpredictable. It's the unknown. We're not sure what's going to happen with health in the future. Personal example for me, healthy, mid-30s, right? And then boom, an appendix comes out of nowhere where inflamed. And if I wouldn't have had insurance or tried to risk it, that's $50,000, $60,000 out of your pocket. So it doesn't matter the age, everyone, right? You just need to keep that in mind. It's unpredictable, but we can also use a couple tools to plan for this gap and bridge it. And one of those is a health savings account, which we're big fans of, the triple tax-free in nature, right? So contributions, tax deductible. If we invest it inside the health savings account, that also grows tax deferred, and then it can be used tax-free for medical. And as I mentioned, the COBRA premium payments are actually one of those that you can use the HSA for. Or you can also look at maybe getting a higher deductible plan, which has cheaper premiums through the exchange, and use the HSA, knowing if you have a good chunk of money saved in the health savings account, that you have out-of-pocket maximums or deductibles covered for future years.
That's a great idea. In fact, I think the HSA is the absolute best savings vehicle on earth. It would be as if a 401k and a Roth IRA got together and had a baby. You get all the tax benefits, the tax deferral, the reduction in taxable income by funding an HSA. And then if you do everything right and follow all the rules, the money that comes out completely tax-free. It's something, regardless, folks who have the ability to participate should participate fully. And actually, for younger people who have incomes, especially dual incomes, I would really consider using the HSA again as a savings vehicle. Think of it as another 401k, and use just regular household cash flow to cover the miscellaneous healthcare expenses, the deductibles, copays, et cetera. Certainly, when you're in retirement and generally you have less income, less cash flow, being able to use some of these savings vehicles to fill the gap and fund that, it becomes more important. The money is worth more from a spending perspective in retirement. So that's really, really, really important. The other thing about COBRA, and this leads into this discussion now about what other alternative funding strategies are there? Because there are a few. What's interesting is now with Obamacare or the Affordable Care Act, you have the ability to go out to an exchange and purchase healthcare. And when you go out to the exchange, you'll see a variety of different offerings, some with high deductibles, some with low deductibles, some that are traditional healthcare plans, some that are more of an HMO or PPO. So you should be able to find something in your area that generally fits your needs. The big advantage of that is it used to be when you left an employer and you went on COBRA, you generally had to accept COBRA because you might have had some medical baggage. You know, somebody in their mid 60s is probably not quite as healthy as somebody in their mid 30s. And there might be something there, a recurring or chronic issue. And that becomes a really big problem when you're shopping out healthcare rates that are effectively medically insured. Well, with the advent of ACA, the Affordable Care Act, or affectionately called Obamacare, those are guaranteed issue. So you don't have the worry of being disqualified for coverage. And it's important to take a look at that because some people might be quite surprised that Obamacare may very well cost less than the COBRA cost to continue the coverage. So that's certainly something that we would want to consider and take a look at. The other areas that are helpful from the standpoint of innovative strategy, you know, we talked about HSA. Very similar and akin to HSA would be, if need be, the use of Roth IRAs. when you're over 59 and a half, and the Roth IRA has been open for over 5 years, you have the ability to extract money tax-free. And that certainly is an area that might help fill those gaps. You could also tax manage an investment account by harvesting tax losses as they appear and use those tax losses to offset gains elsewhere. You may be able to extract monies from those accounts without incurring tax liability as well. And that will help offset or cover some of those medical costs. The other thing we need to consider is that medical costs, including premiums, are typically tax deductible. Now, they're only tax deductible for those who itemize. And with the Trump tax cut, there are a vast majority of people who just take the standard deduction and no longer itemize. But as there's talk that they're going to let the Trump tax cut kind of fade away and we go back to what we had before, the standard deduction more than likely will be less, making itemizing of one's taxes more prevalent and certainly more beneficial. To itemize your total amount of medical cost, out-of-pocket copays, premiums, et cetera, have to exceed 7.5% of your adjusted gross income. So it's important to take that into consideration. So at our firm, we're a big fan of doing annual pro formas where we kind of project out what the tax situation is going to look like. And that drives a lot of equations. We have the ability to convert Roth. Do we have the ability to harvest capital gains because we've gotten a client in a lower tax bracket where there are no capital gains taxes? It's also important to take a look at that from the perspective of where do we pull money from? If we have the ability to deduct those medical expenses because they exceed our 7.5% of adjusted gross income, then maybe we pull that from a taxable source. Maybe we even pull that from an IRA. If in a particular year we're expecting a large charitable deduction, we may want to use IRA money to satisfy the shortfall for medical care. In years where we don't have that, in years where we can't itemize, then certainly extracting that money from a tax-free area like an HSA or a Roth IRA certainly makes good sense. And then the other thing we need to consider as well is when we're looking at where we're pulling money from these areas, we have to also consider something called IRMA, which is the income-related monthly adjusted amount. It's basically a separate tier of modified adjusted gross income levels that drive higher Medicare premiums. So you want to, as much as possible, stay underneath that. Otherwise, you end up paying a whole lot more for the healthcare cost you have. Another thing that we need to consider when we're talking about healthcare and talking about planning and talking about this gap, we also have to consider the couple and those ages and also what's happening there. I mentioned there is no broad brush. It is very customized when planning one's cash flow, especially around healthcare costs. But consider the complications. Let's say you have a couple. One individual is now covered under Medicare, but the other spouse, who is now also retired, so does not have coverage through work, needs to receive coverage through, let's say, Obamacare. Yeah, because it's effectively cheaper than, let's say, COBRA. And this year, it goes away next year, but this has been a chronic problem for many years. Medicare has, with prescription drug coverage, this donut hole where once you spend a certain amount of money combined, I think it's $5,030, you fall into this donut hole. And you don't come out of the donut hole until you personally have spent over $8,000 in prescriptions. It's a huge cost to individuals. Well, when you add up the Obamacare cost, which can be $500, $600, $700 a month, depending on the coverage choices in your local area, and the cost of Medicare, and the cost of all the expected out-of-pocket, et cetera, a couple for that period of time within that gap can easily spend $20,000 or more on healthcare. And usually that's not something that's typically considered when you're in your mid 50s, projecting retirement out 10 years or so in the future. So it's really important to take that into consideration. Sometimes we also flip-flop healthcare. If we have somebody who's always carried the primary coverage for the family, once he or she retires out, if the other spouse is still working for a few years, we may want to consider moving the family onto that coverage for a period of time. Again, delaying this period when you're in this gap where you're not receiving coverage and you've got to finance it yourself. So making sure that we plan this thing out. And usually what happens is one retires, we fall into this healthcare gap. We are anticipating a higher level of spending and a higher level of cash flow. And then it will then typically set back down a bit when both are on Medicare at some point in the future. But having the resources to plan for that ahead is extremely important.
Yeah, Jim, I think it's interesting to think about. You could have two employees, both work for the same company. Let's say they're both engineers, make the same exact salary, putting the same amount away for retirement, and they have the same exact lifestyle needs. However, the way those assets are structured could dramatically impact their healthcare costs in retirement. As you mentioned, for example, using Roth or capital gains accounts to keep their income, which is used in the exchange to calculate the premiums, would be dramatically different, where they've done the exact same thing. They're doing the right thing, right? They're saving well for retirement. It's just how those are structured could end up saving thousands, tens of thousands of dollars just in premiums. I think that's interesting to consider.
It is. We'll touch on this in a little bit, and I may repeat myself, but when you're faced with this healthcare cost, it can put some undue stress on the couple. And then generally, when you're operating within that undue stress, you generally start making poor decisions in terms of how you allocate assets, how you extract assets. And as you just alluded to, you can wind up paying a whole lot more in income tax. It can trip other things. So it becomes kind of this cascading domino effect of just bad decisions.
Yeah, and it's just tricky, as you mentioned, when the spouses there's an age difference, right? Hitting those hurdles. Then also children too, for those looking to retire early. If they have a 22-year-old or 24-year-old still on their plan, health insurance, that could impact as well for the family when to make those decision points in regards to health insurance.
Oh, yeah, I mean, absolutely. Just looking at our firm as an example, I just turned 65, and my wife is a few years younger. We have a Blue Cross Blue Shield plan that we absolutely love. And because of my age and the plan, I had to move to Medicare, but I have to keep the group coverage in place to ensure that my wife has the coverage she's always had. So in our case, I'm paying the exact same premiums that I was paying before when she and I were both on Blue Cross. And in addition to that, I'm now paying Medicare costs as well to provide that as a secondary insurance against my Blue Cross. So our total healthcare cost has gone up about $8,000 a year, more than it would have been otherwise, just because of this weird gap in age and what the coverage is causing us to do. So it's really important to kind of map those things out.
I would imagine when you mentioned that a lot of people would think, oh, you're on Medicare, your health insurance is going to be cheaper, right? And not in every case. It's very intricate, the details when you're looking at the age gap. Speaking
Exactly.
of that, big concern for clients in retirement, certainly front end getting to Medicare through Medicare, but the back end of retirement can be quite expensive as well, which referred to as long-term care. And that's also could be intricate with spouses' ages difference, or if they're the same age, worried about one being able to help take care of them. A lot of clients ask, does Medicare cover long-term care insurance? When we're referring to as, in-home care, nursing home care. And many are surprised to find that there's really not a lot of help from traditional Medicare or Medigap insurance. So that would be part of the discussion where we need to make sure we're saving for insurance, certainly in the front end of retirement while you're young and healthy and doing the bucket list items, checking them off. And then also towards the end of retirement as well can be quite expensive. Many options there. You can simply, what we refer to as self-insure. Could mean the assets that you have are large enough where the average stay in a nursing home is less than 3 years. You run the math at $10,000 a month, $360,000. And then there's others that are from experiences from their parents or grandparents are just horrified. They don't want all their assets to get burned through, right? You just paying for simply health and care, and there's not a dime left over for the heirs. So that's also a valid concern. And in that case, be looking at traditional long-term care insurance, which many clients don't like the aspect of it. It is a use it or lose it policy. So you could pay for your whole life, have a heart attack, pass away, and it's gone. You don't receive any of the benefits. It'd be similar to auto insurance where you pay for it. If you don't use it, you lose it, which can be kind of unnerving for clients, again, sacrificing traveling or hobbies in retirement because the long-term care insurance premiums can be quite expensive. We're not looking at, a couple $100 a month because you want to make sure those benefits are large enough, your average daily benefit the insurance policy will pay for to cover the long-term care stay. And then also, as you know, medical inflation is quite a bit higher than the 2 or 3% average consumer price index inflation in the U.S. over the last 30 years. Medical has been quite higher than that.
It sure has, and it continues to be. And as we all get older, the trend is that's kind of a hot area in terms of real estate, developing and building nursing homes and assisted living, which just kind of tells you that the expectation, the trend is more and more and more people are going to use those services. I'm sure you've had experience with clients as well. This whole concept about long-term care is really quite emotional. And there's a lot of motivators to decide to get some degree of coverage or not. Some people do it because they're worried that they're going to spend down their own assets and they won't have enough to satisfy their needs. Others use it as an attempt to ensure that there'll be some legacy, that not all the assets will get spent down should one or the other or both wind up in a nursing home. And these are all really valid reasons. At the end of the day, we can help with that conversation. We can help with that decision process. But the thing we can really help with is to put some math behind it. And one of the things that we often will do is we'll run something that we refer to as a financial fire drill. And the financial fire drill is essentially a detailed retirement analysis. And then what we'll do is we'll make some assumptions. We'll make assumptions like, well, what if one or the other spouse were to go into a nursing home and it were an extended stay? What would that look like? And what would that do to the assets? And would that compromise retirement for the other somewhere down the road? We do the same thing with death. Do we need a lot of life insurance in retirement? Folks will often ask. Well, let's run that retirement fire drill. And let's assume that one or the other predeceases the first earlier in retirement, not at the typical end of the plan, which is where most retirement plans fail. The assumption is, hey, we're all going to march into retirement and we're all going to live into our 90s and then we'll both die within just a few years of each other. You don't see the chinks in the armor there. You see them when something happens that's contrary to what we're expecting. So by running this, we can really look at the math. And we can also say, well, if we need this, because this is a risk, what does the cost of this look like as it relates to the same retirement plan? Do we extract several $100,000 up front to cover that healthcare cost? Do we employ a higher degree of cash flow because now we have an annual premium to pay. And what does this do? Once you understand the math behind it, you can then kind of work your way through the process. And you might decide, hey, we'll take a chance, or hey, our asset size is such that we are truly self-insured. In other cases, you might still elect to look at some type of policy because of either history, what you've gone through with parents and grandparents, or the fear that, hey, our kids are scattered all over the country. More than likely, we don't have anybody close by that would be able to take care of us in the event that we needed some degree of help. So long-term care is certainly something that should be considered or at least looked at. We wouldn't be doing our job without at least bringing that to the forefront. And everybody, if the idea is to work through contingencies, it probably makes sense to at least consider it. All of this is all about reducing stress. And there's nothing more stressful than retiring, assuming you need X, and then waking up to the fact, after better understanding what copays, deductibles, donut holes, cost of coverage looks like, realizing, oh my goodness, I need a whole lot more for a period of time. As I said, that leads to typically bad decisions. Well, I'll just have to take more money out of my IRA. Well, okay, now we have higher taxable income. Does that trip IRMA? Are we now paying more for Medicare? Does that move you into a higher tax bracket? Now your capital gains are taxable where they weren't before, on and on and on. So the solution is plan ahead. In our firm, we're a big fan of setting assets up like a triangle. Think of it as triangulation. We want to have assets that are tax deferred. Think of that as IRA 401k, because there is a tax deduction because your employer is putting money away for you. But we should also make sure that we're funding regularly something that will be tax-free, whether those are Roth contributions or HSA contributions. We need to have a bucket of money that we can extract that would be free of tax. And then what I would call tax preferred isn't what is normally considered tax preferred, which is typically annuities. All you're doing is kicking the tax problem down the road. You're not solving anything. It's a delayed mistake. But rather an account where you can pair gains and losses and extract capital without any tax consequence at all. That's just a general investment account. Having those things in place provide the tools and the resources to be able to make these decisions, to be able to cover healthcare, and be able to do it in such a way that doesn't drive your cash flow and taxable income into a much higher level. So planning ahead is really, at the end of the day, the answer. Darren, anything else you'd like to add? Any other comments regarding this?
Yes. And also one, with working with clients, some of them are surprised they actually overestimate how expensive healthcare would be. So that keeps them from retiring because they think, oh, geez, it's going to be thousands a month. And they just put it on the back burner and they just keep working and then till 65 and enroll in Medicare. So I'd just like to add that too. It may be less expensive than some clients or pre-retirees are planning for. But again, that's essentially just like an investment portfolio. There are different risk tolerances, right, for getting different healthcare strategies. But it's just unique to everyone and in their own circumstances.
Absolutely. No broad brush. Everything has to be individualized, which makes our job interesting.
Yes, it does. Yep. Every day's a different day for sure. A different situation. We gotta help, and that's what we're here for, though.
That's right. Well, listen, Darren, thanks so much for being on the podcast today. Thanks for your insights regarding healthcare. It's a huge issue. We certainly wouldn't be doing our job if we didn't take this into consideration as we're working with clients to better plan for a bigger, bolder retirement. Thanks so much.
All right, folks. It was a great discussion, gentlemen. Thanks. And as we wrap this up, it is another great reminder. We all need to plan early, as Jim said, and explore all the options. Planning for healthcare and retirement can be complex, but partnering with someone who has the knowledge and the experience to help you bridge this gap effectively, well, they can make it a whole lot easier. Retirement should be a time of joy and fulfillment, not stress over healthcare costs. Darren, thanks so much for being here today. Great show. We look forward to having you back on the podcast very soon. Please be sure to subscribe to the Retirement Engineer podcast so you don't miss future episodes, and follow at Kaydan Wealth on social. Let us know what you think in the comments, and please share topics you'd like us to discuss in future episodes. Following and sharing this podcast helps our small show make a larger impact.
Thank you for listening to The Retirement Engineer with Jim Kruzan. Click the follow button to be notified when new episodes become available. Visit our website at www.kaydanwealth.com or give us a call at 800-638-6900. The information covered and posted represents the views and opinions of Jim Kruzan and this episode's guests, not necessarily those of Kaydan Wealth Management. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.